Everybody, and welcome to the 2022 Digital Dementia Fayre. So many of you will remember that we trialled this through COVID to support all of our friends and family and patients and local community, as well as our own staff, through a virtual medium of questions and answers, and basically developing a whole co-partnership for improving care and social network for dementia. So I'm here today, Professor Nancy Fontaine, as Chief Nurse and also Executive Sponsor for all things to do with dementia and improvement for the Norfolk and Norwich, and indeed across our community, to welcome you to this really exciting event. And what I'm going to do is I'm going to actually ask for all of my compadres who are dialing in virtually just to say a little bit about who they are and what they do, because sometimes it's a bit difficult to know what a title on a badge does. I know I'm often confused about my own title. But I think the important thing today to note, just a little bit of housekeeping, is that everything that we discuss today will very much be around keeping things anonymous and protecting patients and relatives and families and staff. We won't be sharing any patient details. And obviously what we know is that people and colleagues and our local community and patients and families have submitted questions to us so that we can make sure that we've got the right information for you, because what we learned from our previous event is that actually more and more questions come and we need to make sure that we support you with the right information, because that helps us prepare and improve our services. So that's all I've got to say, and I'm going to basically open up all of the panel members that are sitting around me, because these are the experts. So I'm going to go in no particular order. Okay, so I have in front of me, I have Elizabeth Yaxley.
Hello Nancy, hello everybody. My name's Liz Yaxley, or Elizabeth if we want to be formal. I'm Dementia Services Manager here in the Norfolk and Norwich University Hospitals Trust, and my job is around making sure our dementia strategy moves forward. So that's everything we want to do to achieve better care and support for our people living with dementia and their families, and I manage our dementia support team here in Norfolk and Norwich Hospital too.
And we can call you Liz today.
Please do.
And I know that I can definitely say Jenny Walgrove.
Hello, yes. Hi, my name's Jenny. I'm a dementia care specialist nurse. I work in the dementia support team, supporting inpatients living with dementia. That will be looking at their the nursing needs while they're here in hospital. So it might be looking at reasons why someone might not be eating and drinking, why they might feel quite distressed on the ward, and helping the staff on the ward to care for that person. And we're lucky enough recently to have had Sandra join our team from the mental health liaison team. So I'll get Sandra.
Hello, nice to meet you all. My name is Sandra. I've been working with the mental health liaison for about 3 years, primarily with what we call the organic or the older adults within the hospital, which there's a big proportion obviously include working across, you know, all the needs of people that have dementia in the hospital, and making sure their families as well have, you know, sometimes get the right information at the right time. And we've been privileged enough, and I'm very lucky now to have a 6 months secondment with the dementia support team. I'm looking forward to that.
Brilliant. Thank you very much, both of you. I'm now going to move to Dr. Sarah Clark.
Hello, my name's Sarah Clark. I'm one of the consultants here at the Norfolk and Norwich Hospital. I'm based predominantly on Loddon ward, and I am the clinical lead for dementia in the trust.
Thank you very much, Sarah. And back for more, because you and I were on this panel with Liz and Jenny last time. And can I introduce Davina?
Thank you very much, Nancy. Hi, everybody. I'm Davina Helen. I'm the local services manager for Norfolk and Suffolk with Alzheimer's Society. I've been with the society for about 5.5 years now, and my role involves management of services, the delivery of services, and supporting contracts, and also really managing the community teams. So all of our dementia advisors and our dementia support workers who are out and about delivering that face-to-face service across the community.
Thank you so much. And I'm going to move to Emma. I think, Emma, you're the last one here.
Thank you. Morning, everyone. Morning, afternoon. So my name is Emma, and I am the Admiral Nurse Clinical Lead for the service now covering Norfolk and Waveney. So my role as an Admiral Nurse is a dementia nurse specialist, and we support families affected by dementia who have complex needs or are going through a period of difficulty, and we're working in partnership with the new Dementia Support service that we'll be talking about today.
Fabulous to have you here, Emma. So now, just so that for everybody dialing in, we have a game plan, always good to know. So we've had our introductions, and you will remember before we had a short presentation, and today we've got a wonderful presentation from Davina and Emma. And then Liz and Sarah are going to give us an update. I think Liz is going to do that on our amazing dementia strategy, which you've heard us talk about before. And then we move to the question and answers that we'll have via the chat box and any that have been sent in prior to the event. So this is how we really are supporting Dementia Action Week. So thank you very much. Without further ado, we're going to move to Davina and Emma, who are going to lead in with a presentation.
Okay. Bear with me while I share my screen. No, it's not on. Wait a minute.
We can see something.
Nothing brilliant, I don't think. How's that looking?
It looks like a web page. It looks like a web
Oh,
page.
is it? Oh no, wait a minute. Let's try again.
Don't worry, Davina. These we all have these little moments.
How's that?
It. We've got a
How's that
front
looking?
title slide.
How's that looking? That's good. Okay. So this afternoon, Emma and I are going to talk to you a little bit about the new Dementia Support Service for Norfolk and Waveney that was launched on the 1st of April this year. So I'm Davina Helen, as I've already said. I am the one of the services managers for Norfolk and Suffolk.
And I'm Emma Chris, and I support with the Admiral Nurse component of this service.
So we wanted to start off really by just giving you a little bit of an overview of the organisations that have been involved in this collaboration. Alzheimer's Society. So for those of you who are not aware of Alzheimer's Society or don't really know a huge amount about the charity, we are a United Kingdom-wide care and research charity for people with dementia and their carers. The charity operates across England, Wales and Northern Ireland, whilst its sister charities Alzheimer's Scotland and Alzheimer's Society of Ireland cover Scotland and the Republic of Ireland respectively.
And the other organisations that form part of this from our side, so the Norfolk and Suffolk NHS Foundation Trust, who employ the Admiral nurses within this service, and that's been a new part of the service from the 1st of April, and they are the local mental health trust supporting people with mental health and learning disability needs across Norfolk and Waveney. They work, so we're employed by NSFT and we are supported by Dementia UK. So that is a national Dementia UK charity, and Admiral nurses form part of that. So we are specialist dementia nurses that are supported by the national charity, and our background is working with families and carers and people living with dementia to support them when things become difficult. The actual name Admiral Nurse originates from the people who originated the charity, that was the first person living with dementia who was called Admiral Joe, and that's where the title Admiral Nurse has stuck with us. So that's carried on, and that's why we've got our name as Admiral Nurses, even though we're supported by Dementia UK.
So a little bit of an overview about the service aims. So the Dementia Support Service will provide a specialist dementia support service for people living with suspected and confirmed diagnosis of dementia. The service will use a range of interventions that help people with dementia, their families and carers, through developing appropriate knowledge and skills, support mechanisms and resources as appropriate to individual needs. And the service will include, as it says on there, clinical and non-clinical specialist dementia support. Support for people living with dementia, their families, carers again, and loved ones, and support through and throughout the pre and peri-diagnostic pathway, post-diagnostic and through to end of life, and also post-bereavement.
And one of the things that was really important for us, in the background of developing the service was, the integration within the service and making sure that people weren't repeating their story, and that was there to support someone when needed through different parts of their journey. Often what we were hearing is people having to repeat their story to different services, or perhaps not knowing who to contact and at what time to contact who. So I guess the values underlying this were that the service, we wanted it to be accessible, we wanted it to be easy to access, and we wanted it also to deliver the care to the people at the right time when they need it.
So the original working title for the model was the Specialist Integrated Dementia Support Service, commonly known as SIDS to those who were working on it, which didn't really roll off the tongue particularly well, didn't really mean anything to service users. So we have been out and co-produced with service users the name the Dementia Support Service for Norfolk and Waveney. But the service itself is made up of 3 tiers. The first tier, tier 1, is the single point of access, and that is based, the single point of access is based from the what is going to be known as the Dementia Hub, based at the Alzheimer Society offices in Norwich, and that service is manned by trained and experienced telephone dementia advisors. The service is available Monday to Friday between 9 and 5. The Tier 2 service is going to be delivered by the community-based dementia support workers. It's employed by Alzheimer Society. So that's very similar to the services that we've been delivering for a number of years across Norfolk and across Suffolk. It's going to be bespoke, obviously led by the individual, and it is specialist non-clinical support.
And the tier 3 components, so what consists of our Admiral nurses. So now we're really happy as Admiral nurses that we're working across Norfolk and Waveney, whereas in the past we were selectively just working within central Norfolk. So that's been a real positive from the Admiral nurse perspective. And we offer that complex clinical support. So that is for families and carers who may have complex, multiple and kind of high level of needs that are potentially escalating. Our support is based on holistic assessment. Complexity is very hard to define, so that's about assessing those needs and identifying what that person identifies as their need and the risk and complexity within that. Again, it's about holistic assessment, evidence-based interventions, and working in line with the Admiral Nurse Competency Framework as part of that. And we are accessed through that single point of access, so that there's one point of access. Those needs are determined to see what part or what component of the service they feel their needs would be best met within. The idea is as well that sometimes we may work together with the other tiers. So we may perhaps support people for an episode of when things may become complex or difficult, and if appropriate we might then pass that over to a colleague in tier 2, or we might perhaps collaborate and work together, so that within the service those different components will be fully integrated and work together to support that individual, that family's needs as best as possible.
So the referral pathway. So referrals can be made by professionals through the portal. We can receive self-referrals, and we can also receive what we're calling personal referrals, so referrals from family or carers. All referrals to all aspects, all of the 3 tiers, will come in through that tier 1 and will be triaged at that tier 1 stage. And offering the single point of access enables us to simplify the referral process, provide obviously that consistent triage, work with the other tiers and work within those tiers to identify who is the most appropriate person, be that non-clinical or be that clinical support, to actually get that person to that right place as fast as we possibly can. So the tier 1 stage, if a self-referral comes in through tier 1, they may just require information, advice and potential signposting. Not everybody who is coming in through that tier 1 stage may move through those other 2 tiers as necessary. They may just need and require a little bit of advice, a little bit of signposting and a little bit of initial support. All of their information is then captured, which means that if that person then calls back at a later stage, their information is already gathered and we can seamlessly move them between those other tiers. So again, removing that need for sort of that duplication of providing information all the time. So really, as Emma said, just getting them to the most appropriate professional as fast as we possibly can, and really trying to reduce people having to repeat what they're telling us, because we've already captured that information, and that information is accessible through our system to all of those 3 tiers, so anybody can view and will be able to quickly identify what another worker has actually done, be that clinical or non-clinical. So that's a really big plus for this particular model. The tier 2 part is the specialist non-clinical support, again delivered by Alzheimer's Society, dementia support workers, and that will be a blended approach of face-to-face, telephone and virtual support. And again, it will be led very much person-centered, person-led support, and we will work with that person for as long as they have that need. Potentially may move across to tier 3 if circumstances develop, and again, Emma and the Admiral nurse team may again refer back to tier 2 or tier 1 for that additional support as deemed appropriate. So it's very much a close working model.
And as the same with tier 2, tier 3, we would be supporting people as their needs determined. So that may include telephone, that may include face-to-face visits, potentially video calls, whatever is felt most appropriate for that individual, and in that case that's specific to that individual. In terms of tier 3 support, so the Admiral nurse model, the way we work is in a family model, so predominantly working with carers and families to support the person living with dementia, which is inclusive of that person with dementia where appropriate, but also it's supporting the service, perhaps if people have a complex need that isn't met within our service, making sure that we're identifying where their needs can best be met elsewhere. So that there's no such thing as a wrong turn or a wrong door from our service. It's directing people to that appropriate alternative provision as well.
So referrals. So ideally, we would like all professional referrals to come through our online referral portal. It's really quite straightforward to use, and once you have used it, you will receive confirmation of receipt and a referral reference number. And as it says, we aim to process referrals and contact the service user within 3 working days of actually receiving that referral through the portal. At least start that contact at the tier 1 stage and make those calls, start the triage process for that. In addition to the portal, there is a contact telephone number, and that we'd like that to be used really for follow-up, so follow-up contacts. So if a referral's been made through the portal and you want to chase that up for any reason, you just want to find out exactly where that is, whether that service user that you've referred has been contacted, there is a contact telephone number, and we'll pop that in the chat box before we finish today, so that you've got that as well. This is just a quick slide on the portal referral form, so you can see how straightforward it is. It is accessible from the external Alzheimer's Society website. But again, the slides of the presentation today will be made available, so you can have that, and we'll pop that again in the chat box so that it's easy to use. It's very straightforward. If you have any problems with it at all, then please get in contact with us. Please call us, and then we'll try and work through it with you. But I think the feedback that we've had is that it's really quick, and it's really straightforward, quite intuitive to use.
And looking at integration forms a really important part of the service, both internally and externally. So, internally, having all these partnership organisations come together is really exciting, because it means working all together, we can really support that integration under one roof. But also working with the wider community and other services for us is really important. So it's about trying to join up that care, make sure things are as coordinated as able to, reduce duplication, improve people navigating through the care systems. We know often these families and individuals will have contact with numerous services, maybe in contact with numerous individuals. So it's really trying to join up that work in as much as possible. And I guess that vision is going forward, we'll be scoping and looking for opportunities to make sure we're integrating with those wider services and look at how we connect and work with all those services in a really positive way going forward. And looking at, I guess, the integration and those steps going forward. So part of the Dementia Support Service is having quarterly steering group with those kind of key stakeholders and individuals, reviewing, what's working, what we need to adjust and to keep evolving and developing as a service. It's about linking in with kind of key other meetings, in the community as appropriate, and looking at the wider vision really. So, looking at local events, perhaps, training opportunities, and really just looking at how kind of as a wider part of Norfolk and Waveney, how we can support those wider visions of making the community, more dementia friendly and helping all those systems to work together in a positive way.
Any questions?
Thank you both, Emma and Davina. That was beautifully clear and so just very concise for people to understand. And I'm presuming that will all be on our website. That's what I'm hoping, so it'll be freely available, because I know people want to go back and have a look. Anything that anyone wants to add from that? That was a great presentation, and actually what we would want to do is make sure that all of our NNUH colleagues had access to that, so that they could then talk it through. Thank you. Liz, I know we talked that we might not have time, so we do want to make sure we give as much airtime to all our questions and answers. Did you just want to give a little brief intro or update on our strategy? Because I think it's so important, because it's such a superbly co-produced strategy. It would be remiss not to talk about it, and then we can move directly into the questions and answers.
Yes, of course. So we launched our dementia strategy for the Norfolk and Norwich University hospitals last year, and we've been working very hard at making sure that we're looking very comprehensively at all of the 8 goals of our strategy. So we've got 8 big themes about ways that we can support our patients and their relatives to have the best possible experience while they're in our care, and right through to that point of discharge and beyond. So those 8 goals are about creating a skilled workforce who are educated and able and competent in their work, whatever their role is, It's about working together with our carers and partners and GP and community services. It's about getting our assessments right. It's about person-centred care, which is at the hub of everything that we need to do when we're delivering and working with, delivering our care and working with people who are living with dementia and their families. It's about getting the right support from our volunteer services right across the hospital. It's about getting our environments right. So looking at, maximising the ability for people to feel comfortable and orientated and increase their sense of well-being in the environments in which they are cared for in our in and outpatient areas. It's about making sure that we're looking at research potential here in the hospital and making sure that people have access to research and best practice information. And it's about making sure overall of that we have the right governance of this strategy so we can provide best possible care for our patients living with dementia. So just a couple of things. I don't want to hog the time here, but just to highlight a few things. So regarding our workforce plans, we decided that we wanted to home in on the education bits first. So we're pulling together with a working group. We've got just to let you know, we have 8 working groups assigned to every one of the goals that you can see in front of you here, and leads for each of those goals who are working with a team on looking at what do we need, what do we mean by this, what's the detail of what we want to achieve, and getting on and making sure that we are going to achieve that over the next few years. So, this is very much work in progress, but we have got a lot of things on the go. So regarding our skilled workforce, we're working on a big training plan that will be appropriate. We can assign different levels of education need to different people who work in the hospital. So some people might need more intensive education than others, depending on your role. So people will know which level that they need to complete. And we're working alongside our colleagues at UEA to look at developing what that training plan might look like. We're doing some great work in the background around making virtual reality films. So we've worked with a lot of our volunteers in the trust who were actors for the day, mocked up what it might be like on a ward, and filmed some scenarios that are common scenarios. And if anybody, it's quite difficult to kind of imagine this, but if you, we are filming virtual reality scenes from the eyes of the person who is our patient. So it would be a patient living with dementia, and you can view the whole ward mock-up from the sort of through the eyes of the person, of the patient. So it's very interesting. We're doing sort of, there'll be some interesting learning through that, which we'll build into our education plans. Other things that we're doing, our volunteers, for instance, have really built up some great services to support our patients. So doing things like helping people and their families to complete This Is Me booklets, which really help us to understand more about the person and their needs and wishes. And that really helps all the staff looking after the person while they're in our care. The volunteers are also acting as mealtime assistants, so offering extra support there. They're working with our dementia support team to add additional support and companionship. They're doing get up and get moving activities with patients to get their physical health, to continue to keep moving while they're in hospital and keep their physical skills going, and also developing pets as therapy dogs. So we know that they go down a storm having dogs, visiting our patients on the ward. It's really great comfort and pleasure and fun. So there's an awful lot that we're doing, things such as streamlining our referrals to the Mental Health Trust, NSFT, for people who we think may have a diagnosis of dementia, but we need them to have a more formalised assessment. So we're streamlining that process, and we also continue to have our mental health liaison team in the hospital who can give that level of support and advice and assessment while the person's in our care. So all sorts of things going on. I could go on forever, but if anybody has any questions, please put them in the chat box. I'm happy to answer them.
Thank you, Liz. I do think it's so important because we've crafted this together with members of our community, and it's really important that they can see how we track progress and how also influencing across Norfolk and Waveney. So thank you for that. I'm now going to move all over to the questions and answers, and thank you all very much for the questions that have come in advance and that are being added to. So I'm going to move over to Derek. So thank you very much, Derek. Great questions about the most effective practical persuasion strategies and tactics for patients with dementia. And also you've asked us a second question about what measures to improve in-hospital, in-home emergency and out-of-hours support for later stage patients with dementia and their families. Now, I'm going to see, I wonder if Jenny, that first part of the question, and you might actually be able to be supported by Davina as well on the second part. So if the panel think they really got the answer, it would be helpful to me to know who'd like to answer it. But I'm going to pick on Jenny to start the ball rolling. Thanks, Jenny.
Yeah, no, that sounds great. It's a great question, something we get asked quite frequently in our roles. I think the most important thing from our team's perspective is to get to know the person. Everyone with dementia is completely different, and how they respond to situations will be different as well. And to remember that there's always a reason why someone might be doing something. So we often use the example of people taking their medication. So in hospital, someone might decline their medication. Might be because the medication looks different to how it is at home. It might be because they don't know the person that's giving it. They might be a bit unsure about what it is that they're having. So it's just kind of get to know the person, what's normal for them. Is it just simply we can explain what each tablet is? It looks different from at home. It's just adapting really to what suits the person's needs, and I can't say enough how important it is to get to know the person and what makes them an individual, and what's important to them, and that really helps you adapt to each situation and focus on the emotions of how the person is feeling. So if you notice that someone is feeling quite upset, or they might be frustrated, then focus on that emotion and support them through that. But yes, I'll pass over to Davina to talk about the stuff at home.
Do you think you could just repeat the question again for me, Nancy? So
yes, of course.
Sure. Thank you.
Yeah, what measures are needed to improve in-home emergency and out-of-hours support for later stage carers of dementia patients? So when things are getting really a little bit more extreme and a real sort of help.
I think I'll just echo the initial sort of the initial comment, really, that it's about trying to understand where the individuals are coming from in a given any specific situation. We find that situations can flare up really quickly when somebody's at home, and it could have been it can be a build-up of things over, over hours, over days, over weeks. But I think it's just trying to unpick. I know one of the things that we spend, the support workers spend a lot of time doing, is just trying to unpick how people's relationships work, and speaking to them as individuals and involving both parties, but involving them as individuals rather than speaking to them as a sort of as a crisis situation, and just really trying to understand what's led up to the situation. Is it a case of that further intervention, further specialist intervention is needed, and that may be some statutory intervention in some cases. I don't feel like I've answered that question particularly.
No, but it's a tricky one, particularly out of hours, and that's when our carers and families really struggle. So I think some of this is also about being mapped into the services, and you've heard about Emma talking about Admiral services, so that we can help plan for those eventualities with you as a family. And Emma's nodding, so I know that that's part of it. Derek, thank you for the questions. I thought really good questions. I'm going to move to involve Dr. Sarah Clark now, because this question comes up a lot, and it came up last year. What do you do if you're fairly sure someone, I'm presuming a family member, has an issue, but it could, I suppose it could be a neighbour, but we'll say it's a family member, has an issue that's developing in terms of dementia, but they're in denial and will not seek medical help? So we get this a lot, don't we, Sarah?
Hi, yes, Nancy, yes, we do get a lot. I think ultimately, although it's very, very frustrating for the person who's watching their friend or loved one change, it's ultimately up to the person whether or not they seek help or not. And I think all that we can do, and what we do in hospital, if we note perhaps that someone has got the developments of a cognitive impairment, and to ask if they want to go further, is to just give someone a bit more information. I think lots of people do unfortunately still see dementia as a bit of a stigma diagnosis, and perhaps aren't aware of all the different things that we can offer now, both in the trust and in the community, and the various treatments that there are that might be of some benefit to someone, especially if we catch it in the early stages. So I think it's just giving people time, as you would with any diagnosis really, and if just keep on encouraging them and give them space really to hope that they will agree to come and see one of us eventually.
Thank you. I'm not going to let you go that easy, because it would be quite good, because there are a couple of questions that are linked. Just to really go through the types of, I'm just going to put it in the signs and symptoms to watch out for, and then link into then how do you get a formal diagnosis? If you could pick up both arms, Sarah, and then I'll move on to another question. So, sorry, Nancy, you were saying about the signs and the symptoms of dementia to look out for first. Yes, please. It could be little things really, like forgetting where you've put things, losing words and sentences, perhaps like I'm doing a bit now, but more repetitively, and forgetting people's names, family members' names, those sorts of things. That's particularly more with dementias like Alzheimer's. Vascular dementias tend to present slightly differently, so you might see people perhaps not have many changes with memory initially, but perhaps have more changes in personality, perhaps change in diet, changes in alertness, changes in awareness, perhaps getting lost in what was a familiar environment suddenly becomes quite strange and a bit confusing. And then how about we go about getting a diagnosis? There's different pathways really. So if you're at home noticing this with a loved one, then if the best thing is to try and get them to agree to go and see their GP. The GPs usually will do a cognitive screen and probably send some blood tests, and then we'll refer to the community psychiatric team, and they will be seen in a memory clinic. If it's in the hospital and you've noticed that your loved one's having problems and then they get admitted, then talk to the team that's here that's looking after your relative, because we can start that screening process to save the delay in then waiting to get home to then see the GP. And we have our own referral process within the trust itself, which we call a Memory Matters referral process, both of which ultimately ends up with someone being seen ultimately in some format of community memory clinic, and then the follow-up being made by them if need be, or if not, it would be discharged from them back to the GP. Thank you very much, Sarah, because I know that people do worry about what the process is, and I think that fits beautifully on. And then as dementia progresses is the question, and I'm going to bring in Jenny first about the support we have in hospital, and then I'm going to move to Emma, because people do worry about this, Emma, about dementia progressing, about suffering, and then if you could also pick up about the community support, that would be great. So over to you first, Jenny, to talk about the hospital services.
Lovely, thank you. Well, we're big advocates in our team that you can live well with dementia through your whole experience, and this is my moment really to talk about our amazing team. We're called the Dementia Support team, and we have Liz, who's the Dementia Services Manager for that team, myself as the Dementia Care Specialist Nurse, and I've now been joined by Sandra from Mental Health Liaison. So I'll maybe let Sandra talk about Mental Health Liaison as well in a second. And we have 5 wonderful dementia support workers as well. So the role of the dementia support worker, it will be really to find out about the person, their interests, their likes. They might do this through the This Is Me booklets that Liz mentioned earlier, to find out about more about the person, and then they'll do activities based on that person's interest to try and keep the person cognitively and physically stimulated while they're here in hospital. That could be through trying to reduce the person's distress, helping them engage in interventions, things like that. And from a nursing perspective, Sandra and I, as I mentioned before, will look at the nursing needs of someone living with dementia. Frequently that's regarding eating and drinking, people that are quite distressed in hospital, and supporting through that, trying to identify what might be potential triggers for people, trying to prevent that from happening. If we can learn what it is that's maybe affecting the person, we can find information out about that. We can write care plans to support the wards to care for the person as well. So just to know that our team exists, I suppose is really, really important if you've got a loved one living with dementia in hospital. We also have fantastic dementia links throughout the hospital as well. So that could be anyone in any role. So we have nurses on the ward, HCAs, porters, phlebotomists in all different departments across the hospital, and their dementia link for their area. So every area will have someone like that. And as Liz mentioned, we've got wonderful volunteers. We have some volunteers associated with our team as well. We have 3 volunteers that come in during the week and provide companionship to people living with dementia. I might let Sandra talk about what Mental Health Liaison. Yeah,
the Mental Health Liaison, we worked very closely with dementia. That's quite privileged to be able to come and do 6 months secondment. We've worked very closely, and our role as well is to try and, obviously give confirmed diagnosis for people, because often delirium can get mixed up a little bit with dementia. While they can have similar symptoms, we need to be quite clear, let's get the right care for our dementia support workers and to our dementia patients that sadly are in the hospital. So we try to go in quite swiftly as we can to minimise distress, not necessarily using mental health medication, but using a combination of everything to make sure that even some physical things that happen for people, they can get addressed quite quickly. So if we do have to use medications very temporarily, to then tail off again as quickly as possible, to help people's journey that come through the hospital to quickly get that turned around as quick as we can, and help support to move them back into the community and back to their loved ones. Sometimes just to support in the ward to say, please can we have loved ones come to visit, because I appreciate with COVID that's very difficult, but we just realise the impact of having someone they know and care about, just being able to come in even if it's at meal times and things, that's a real big help for us.
That might be a good time to hand over to Emma.
Yeah, perfect. So I guess just to echo all those things, I think, you can live well with dementia no matter what stage you're at. It's just about adjusting and enabling that person. We try and make really good connections with the hospitals as well to kind of smooth those transitions between community and kind of hospitals for individuals. But there's lots of support out there in the community. I guess it's just finding out what's available to you, both as a carer and for that person living with dementia. So in terms of from a physical health perspective, you do have your GP if there's worries about their physical health status, or you've got concerns or would like things to be reviewed. We've spoken today about the Dementia Support Service, and that's always there as a point of support and reference for both of you. Also looking at, social care provisions. So perhaps if you feel someone might need practical assistance or support, there is, social care and Norfolk County Council who can advise you. And within the community, the community is very active in terms of having local groups, local peer support networks, and there's lots active going on locally, and lots of families we work with, that's been a real lifeline to them in having people, peers around and that are going through similar, that can support them and that can guide them, and building friendships based on that as well. So I think the important thing out there's lots out there. If you're not sure where to find it, contact the Dementia Support Service, and that's something, you know, we can signpost you and direct you to help you navigate that and find the best place for support for your circumstances.
Thank you both very much. And actually, just a question further along the line, and obviously we've got strong links with all of complex health through with dementia and indeed mental health, but also just we work very closely with the learning disability and autism team here, don't we? So that would be through you, Jenny, and the team. So you would link and work together, weren't you? Because you are colleagues of the same team, because somebody's asked that question.
Yep, so we all sit in the Complex Health Hub here at the hospital. There's some people that are living with both the learning disability and dementia. We all get referrals through an electronic system here, and sometimes they might get referrals through to their team before us, but we'll let each other know that we might need each other's speciality, and sometimes we do joint reviews together. But yes, we work really, really closely, and it's just kind of whoever gets a referral first will let the other person know. It works quite well.
I hope that's answered your question, but it was a good question to ask. Thank you very much. I'm going to move to Davina, because I think this is where the Alzheimer's Society and how we can really help communities here. And this is, what plans should I make with my partner to prepare for a time where he may be less engaged in decision making, you know, really forward thinking, and how can we help?
And that is a question, absolutely, I think that people are asking, every day of the week nationally. So I think the key is really is to start that planning process as soon as you feel able to, and have those conversations, together is absolutely key. But certainly there is such a lot of information certainly on Alzheimer's Society websites and many other websites, Dementia UK, Age UK. You will find vast amounts of really good, really sort of easily understandable information in how to sort of go about really what is planning for your future, be that in a legal sense or be that in a sort of in a care provision sense. So if anybody feels that actually it's something that they cannot, they don't feel that they can go through the mine of information and sort of dig about and try and find it, then they can always ring. They can certainly obviously in Norfolk and Waverley, they can contact the new service, and they can have that support, be that through information on fact sheets or links to specific areas to sort of consider, and also the support in order to sort of have those conversations and start those conversations as well, because people are often reluctant to do that, but from experience, I think the sooner you start having those conversations, even if it's just to think about them, the easier it is to navigate the system afterwards.
Very early discussion, starting bring it in, and of course Alzheimer's have got a wealth of information, and we can always and they would have done this time and time again. So it's good to ring in and ask. And there's another question here, which I know that the Alzheimer's Association and we do in hospital get asked a lot about financial support. So I have a relative who's living at home with dementia, alone with dementia, and is having to pay for care visits up to 4 times a day. And is there help available from the NHS to provide this care?
Do you know what, that there is no one answer to that question, because it is based on individual circumstance. And you could have 2 people perceived to be in exactly the same financial situation, living alone on their own, paying for care, and maybe their financial situation is totally different. What I would always say is seek advice. Seek advice if you are wanting to to investigate, you know, future care, paying for care, because a lot of it is sort of is set, certainly for statutory services, financially. There are, you know, cut-off points. The government sets cut-off points. It's set in obviously legislation, and those do change. So I think it is about, again, seek advice, go somewhere reputable. If it's not Alzheimer's Society, Citizens Advice will always, you know, provide some really good, robust, up-to-date, accurate advice. And you know, it is a case of having to look at each situation individually, because everybody's circumstances are different. And there is
I think you've answered that really well, because it is, but hugely variable. So
it's a minefield, I'm afraid.
It is a minefield, but we do get asked a lot.
Yeah.
I'm going to take the next one because I can. So Debbie, great question. Thank you so much. And I'm sure you probably in your role get asked this all the time. So visiting through COVID has been really difficult and challenging, and but I must make sure that it's underpinned. We've been really clear that throughout the entirety of the pandemic, those patients who require some support from carers or family member through any cognitive needs, so it could be dementia, but it could be learning disability and autism, it could be mental health, it could be some communication difficulties. So all along, their important responsible carer or other family member have been allowed to come into the hospital. Now I say that, just we are probably within a hair's breadth away of the NHS Chief Executive Amanda Pritchard presenting to NHS England today on reduction of the alert level. So, you know, I'm already preparing for the next phase of visiting up formally anyway. But I hope that answers your question, Debbie. My 93-year-old mother is in a care home, never been actually diagnosed, but I'm convinced she has dementia. Is there any support for undiagnosed residents in care homes? That is a great question. Who would like to take that one? Anyone want to? Is there support in care homes?
There is, well, recently there has been a project in Norfolk that's looked at areas to improve the diagnostic rate within care homes, and that project has actually kind of had recognition from NHS Improvement and NHS England, so that's been really positive within Norfolk. There is support. I mean, if you speak to the care home can liaise with the GP who supports that care home, and that person has the same right to a diagnosis like any other person would. If you need support in that process, or you're, you know, facing difficulty, you know, approaching that you can seek support in relation to that. But it's certainly an area that is being looked at, being addressed, and working to improve it locally and nationally. So there is support, but it's still evolving and growing, I would say, both locally and nationally.
Thank you very much for that. I want to try to get to as many questions as we can. So there is somebody who's written in to say that they have been waiting for a long time for a memory clinic referral. That was last summer. So what is our advice on that, Dr. Sarah Clark? Can we help? How can we make sure that that referral is not lost?
Hi, if you have been waiting that long, I would think that it probably has been lost, because the memory assessments are happening. We like to wait a couple of months after someone leaves hospital, but there would be 3 at the most. So I would call the GP and ask them to re-refer, because it suggests to me it has been lost. Yeah.
Thank you. Good advice there. Thank you very much, Joe Oldham, for the thumbs up, and our colleague who's a memory impairment nurse from Great Yarmouth. We will be sharing this information today, and we have picked up already about supporting hospital with advanced dementia, and there's a lot of dementia training across, so outside of our dementia support team. Jenny, do you want to just say quickly how we train nurses and support workers and our AHPs to do some of the things that you do with our dementia training?
Yes, thank you. So all apart from the usual training, which is dementia awareness, everybody inducting into the trust will have a dementia awareness session. In In addition to that, all the healthcare assistants in the hospital will have a Dementia Friends session, which is an hour-long session about supporting people living with dementia. We also, as a team, run kind of pop-up sessions on the ward. So if anyone would like to know more information about a particular topic, so it might be about completing the This Is Me booklets, it might be about communication, then we're happy to run pop-up sessions on the ward, kind of come to the ward team, because we know it's hard to get off the ward as well, for training. So we'll come to the ward and do a session in the day room or something like that, based on what the needs are of each ward. And also Mashore ward, Liz and I did some training. It was like a day training for all the staff on Mashore ward that expressed an interest in learning more about dementia, which we've heard has been very well received, and it seems to be really good. The staff on the ward are talking about how all the things that they learned from the training, and how they are taking that to support the patients. So that's been really positive. And I know it's really difficult, as part of that question was about seeing patients that are quite distressed and upset, and just please remember to refer to our team, because we don't automatically know everybody that's living with dementia in the hospital. So if there's someone that you think would really benefit from our support, if you refer to us on ICE under Dementia Support Workers, and then write on the referral what you'd like our support with, or give us a call if you feel like it's urgent, and we'll try and prioritise them.
And I think our message is, whenever families and carers are in hospital, the patients, we always try to make sure that we have discussions about keeping well, and physically well. So that is part of what we do, and also support for you as carers and family members. That's something, so we extend that. And we do that in hospital, and then we carry that through into the community. And obviously people like Emma and Davina do that on a daily basis. It can be really difficult to navigate through so many pieces of information, but as Davina has said, the Alzheimer Society, this is what they do. They will help families and carers navigate through some multiple, very, very complex questions and organisations. I think that what is important is we will make sure this is shared, as our communication colleague Adam Gretton has said, and we will share that. And I think the other thing is, if there are further questions that actually through Liz and Jenny from In Hospital, we will try, if there is something that we can get that's personal to you, if we can help, then do contact us here and we will try and support you. I love these sessions, and I often think, actually, should we be doing these more often? Thank you for the person who said, I've seen you at the Hospital Carers Forum. I'm presuming that could be any of us, but this is what we do. This is our co-production. So what that means is designing and improving services, and dementia is just one of them, with families, carers and patients. And so this is what, as an organisation, the Norfolk and Norwich do. I just want to thank everybody for writing in with questions, because actually the only reason that this is successful is because you have taken time to dial in and send us questions. And also I would like to thank my expert panel yet again, and I'm just wondering whether we need to take away, do we need to do this more than annually? And Liz and I and Sarah and Jenny and the team might need to put something together, so we'd be interested in your thoughts on that. So thank you all very much indeed, and I hope that you found this session helpful, and we will hopefully make sure that we